It's time for digital consent with Concentric. Concentric is the market-leading digital consent app and has been developed collaboratively by clinicians who understand healthcare. It's used by hundreds of your colleagues every week and is a proven solution in the complex clinical environment. Concentric delivers remote consent, makes it easy to share personalised information, and supports informed, shared decisions. Let's see a demo and see Concentric in action. First off, creating an episode. To create a consent episode for a patient, you search for the patient and land on their record. Here you can see all previous consent episodes and create a new episode. Concentric is used across all specialties and for all procedures and treatments, with evidence-based templates accessed instantly through live search. This includes searching using acronyms and synonyms, making search really fast. We know that lots of the time you're not just doing one procedure, but a combination. That's no problem in Concentric, with the flexibility to get to exactly the treatment information you need. When you've selected the treatment, Concentric provides a template of information for the treatment and does an intelligent merge where a combined procedure is selected, containing only the relevant information. Once the treatment has been selected, it's easy to prepare and personalise the consent information for your patient. As a clinician, you select only the information that is relevant to the patient, including indications, alternatives, anaesthetic options, and risks. Often, information will be quickly selected off the template, but with Concentric it's simple to modify as much as is needed, add custom elements, and add notes to any section. On average, it's 40 seconds quicker to prepare consent information through Concentric compared to using a paper consent form. You're then ready to share the information with the patient. We see Concentric being used in many different ways by clinicians, depending on pathways and preference. Concentric information may be shared during consultation or following, and in clinic, at the bedside, or remotely. ConsultView takes the prepared consent information and shares it in an accessible, structured manner that can be engaged with as part of a consent conversation or outside a consultation. Each element contains rich content and signposting to additional resources, supporting patients and clinicians to make informed, shared decisions. Risks are presented by timing and likelihood, and again supported by lay descriptions and context of what a risk might mean for them. Notes again can be added throughout the process, for example here to document a discussion around material risks. Content and templates can be customised at an organisation level, as well as including links to other local resources. Information is shared digitally or in print with patients, and if appropriate, remote consent can also be enabled. Giving consent through Concentric follows a clear, stepwise approach that can be done in person with a clinician or remotely. Any additional consents can be given as part of the process, for example here for blood transfusion and medical photography. Depending on whether you're on a touchscreen, either a method to hand off to sign on another device is presented, or a signing pad, and the patient's signature is recorded. If done prior to the day of treatment, then consent is confirmed, and the consent form is generated and usually sent into the main electronic health record. Secure and integrated into your workflow and existing systems, Concentric is easy to introduce, and with flexible, cost-saving pricing and free pilot options, it's time for digital consent.